So today we are really happy and pleased that we have Dr. Jane Wakahe, who is an OBGYN, and she will introduce herself shortly. And if you have any questions, I do know that we received quite a couple of questions when we are having the registration form. But if you do have any questions, please feel free to ask them out on the chat session. It would be nice to hear the participants' voices. Thank you so much. Dr. If you could kindly unmute yourself.
Good afternoon. Thanks for this invite. It's I don't take it lightly. I like to let people know what they need to know. So thank you so much for this platform. My name is Dr. Jane Wakahe, obstetrician gynecologist. That means dealing with women affairs, reproductive health. And I've been a gynecologist for the last now 40 years. So it's been a while. We run something called She Chooses to Live. That's the platform we are using on this platform. She Chooses to Live is an NGO that caters for women, especially teaching them reproductive health, and very, very focused on cervical cancer, which is a cancer that should never, ever kill anybody. So that's us, and very passionate. So that's what we are going to discuss today, cervical cancer, and to make sure that nobody in my hearing and no thread of anybody in my hearing will ever die of cervical cancer. So today we are talking about what is called HPV-related cancers. Finally, we'll discuss cancer cervix, but what is HPV? And HPV is something called human papilloma virus. It's a virus that is, there are at least 200 strains already isolated. 16 of these strains are known to cause all kinds of cancers. And that's why we are starting at this point. What is HPV? 16, if somebody harbors any of the 16, they are likely at some point to get cancer cervix, and we'll discuss how many cancers it can cause. So HPV is transmitted from skin to skin, through skin-to-skin contact in the genital area. The skin types are harbored in the skin of the genital area. And this means that any genital area contact, even between women, then we can transmit to each other HPV. Next, please. Now, who gets HPV? And the answer is that nearly everyone who has ever been sexually active, by the age of 50 years, 80% of those people will have contracted HPV at some point. In most cases, though, we are happy to announce that in most cases, the person's immunity is able to kick it out, and it doesn't become a big problem, especially if you are below age 30. Your immunity is strong enough to be able to kick HPV out much of the time. So it becomes a transient problem, which will not then finally lead to cancer. Now, the risk of contracting HPV increases with the higher number of sexual partners that somebody has, and the higher number of sexual partners your partner has. So it's a sexually transmitted problem. So the more sexual partners you have, the more chances that you will contract HPV, and that it will stay and somehow change some things into cancer. Next. So what cancers does HPV cause? The one we all know most is the one called cervical cancer. And that causes most of the cancers. If you hear HPV, you hear cervical cancer. But HPV also causes other cancers. It causes cancer of the throat. It causes cancer of the vulva. It causes cancer of the vagina. It causes anal cancer for people whose anal regions are penetrated with the genitalia skin, and it also causes penile cancer. So all those are at risk of being affected into cancer by HPV. We now come to cervical cancer, and we do an overview of cervical cancer. That if I don't know if you can see my slide, there's a picture of the uterus looking at a woman front back, and then there's a picture of a cervix looking at head on. And that area, written cervix, that's where the cervical cancer starts. If you see the white stuff there at the top where the statement called cancerous tissue is an area called transformation zone. And that's where the cancer of the cervix starts and then spreads both up and down. So the trouble about cancer, if I can first say what cancer is before I even delve into cervical cancer, is that cancer and why it's so dangerous is just yourself and myself. Our cells start changing so that the body is not aware that anything is going wrong. And cancer can develop and grow very big, and it only gets signs and symptoms when it has really grown, so that it starts pushing things around, pushing other organs around, or it goes into organs that it shouldn't go through the bloodstream and lymph stream. So cancer is something that your body is not alert that is happening. It's the cells that start to multiply very, very fast for whatever reason. Cervical cancer, we shall talk, because that one we know what causes them to multiply first. But all the other cancers, hardly do we know what causes them to multiply first. But the issue about cancer cells is they multiply very fast. They refuse to die like normal cells. So a normal cell, just like a human person, has a lifelong, a lifespan. But cancer cells do not have a lifespan. They keep living. And the other thing is that they keep breaking and going to strange areas. For example, you can have your cervix in your lung, which is very, very interesting, or your cervix in the areas. So you don't die organs. So about cancer, yet the body is not able to fight its cancer, because cancer is yourself just growing faster. So if someone, for example, had bacteria system and is able to fight with immunity, but cancer war against it because it's yourself. So that's what yes, what you know is that you turn into cancer 100%. You are not the 3%, it's 100% yourself. So the cause of cervical cancer is the presence of persistent infection with human papillomavirus. I said there are 16 types that can cause this cancer. Now, I already said there are no symptoms at the beginning, and hence why it is very vital that we get screening before it becomes life-threatening. If it is actually cancerous, then some of the early signs that one gets is some vaginal bleeding, especially what is called postcoital, vaginal bleeding after intercourse, when there was no period, or bleeding in between periods, or you do some very heavy duty and you see some blood. Another one is menstrual bleeding that is heavier and longer than usual. Before even that, you get a very nasty watery discharge, a discharge that smells not very nice. And when it's really gone, you start to get pain in the pelvis, and you start to lose weight, and you start to look sick. So some statistics, some global statistics, these are the world statistics from the World Health Organization, that in the year 2023, there were at least 604,000 new cervical cancer cells reported. And out of these, 342 women died from the cervical cancer. And about 90% Africa and in South Latin America, they happen in the low-income countries. Next. Now, let's come to Kenya, where we have a population of about close to 17 million women who are 15 years and older. And in the current statistics is that on a yearly basis, in Kenya, we diagnose at least 5,236 women newly diagnosed with cancer. And out of these, 3,211 died. Now, cervical cancer is the second commonest cancer in women in Kenya, the first being the breast. But cervix stands as the greatest killer of women, the greatest cancer killer of women in this country. It has a very, very high mortality rate. In fact, as we are talking here today, being the 5th of November, 9 women in this country, let me repeat that, 9 known women will die of cervical cancer today in this country. And yet this is something that should never, never kill anybody. Now, that's what cervical cancer looks like. Below there, the area with the valleys and gullies is the vagina. Then that thing that looks like cauliflower is the cervix with its cancer. And it is caused, like I said, by persistent infection of human papillomavirus. There are 16 of them. We are able to test somebody if they have the HPV infection these days. And the two baddest, the two worst are type 16 and type 18. You don't need to know that. If you have even one of the type 16, then you are at some risk of developing cancer. So I repeat again that you don't ever need to get cervical cancer, ever. And if you are, I repeat again in my hearing, if you get cervical cancer and your friend gets cervical cancer, it will be by choice, which is a very sad statement. So there are ways of screening for cervical cancer. The good thing about the cervix is that the changes do not start off as cancer. They, over many, many years, if you get screened, you'll be told your cervix is changing towards cancer, is changing towards cancer. So it's not that, it's not like other cancers, for example, not like the throat cancer or the penile cancer or the skin cancer that suddenly it is cancer. Now, in cervical cases, the cervix actually changes and gives you direction that it is actually changing towards cancer. So you can do something before it actually becomes cancer. So how do we screen for this? The first screen, which is recent, about 5 years back, is we are able now to do what is called HPV screening to check whether somebody has the infection with HPV, because it's the presence of the HPV that causes cancer. Now, repeat again, if you are told you have HPV, that does not mean you have cancer or that you will ever get cancer. What it means is you are at risk of getting cancer and that you need to screen all the time. So we are able these days to tell you whether somebody has HPV or not. We are doing, this screen is only being done for women who are above age 30, because when we are age 30 and below, then we get these transient HPVs that our immunity is able to kick out, and we no longer have HPV, so we do not have the risk any longer. But once you go beyond age 30, age 31, your immunity tends to go down. And if you contract HPV, then you are likely to keep it. Your body is likely unable to fight it off, and you are likely to keep it. So we are able to check HPV. The next screening, something to screen is what is called a pap smear. Now, a pap smear takes the cells of the cervix and they are taken to the laboratory. And these cells can be seen whether they are changing or not. In fact, there are many stages that they change from. They change from something called ascus, they change into something called low grade, they change into something called high grade, and finally change into cancer. And this will take many, many years. So if you are keen on your screens, your pap smears, then you'll be able to know that your cervix is changing towards cancer and be able to deal with it before it actually becomes cancer or when it is still very, very early cancer indeed. So that's pap smear. So we take those cells, we take them to the laboratory, and then they are checked. Now, the other way of screening is something called visual inspection with the acetic acid. We at a very nice light, we paint the cervix. And because cancer cells grow very fast, they show a different color from the normal cells. So if you paint with acetic acid, then cancer cells will look totally white, whereas the other cells will look like normal cells. If the acetic acid, which is just vinegar, very cheap, doesn't work, then the next one is something called glucose iodine, and again, the color change will be different. So we are able to see the color change. This is a good way of screening many people at a time. If we see that change, then we are able to deal with the areas that look abnormal, like immediately cut them off or burn them off or laser them off, so that hopefully the lesion, the cancer is, if it was turning into cancer, the area is gone. The only drawback from there is that you are not able to actually take them to the laboratory and decide had it reached the level of cancer. But the people who do this are experienced enough. If they see like it has gone a bit further, then they'll not do it there. They'll send somebody to the hospital where they'll be checked even further. Now, how would we prevent, other than screening ourselves to see that we are not getting cancer, how would we prevent ourselves from getting cancer? And the only way, I repeat again, human papillomavirus is a virus. We have no cure. To date, we have no cure whatsoever for viruses. The same way we immunize babies against measles, against mumps, is the only way we can manage to protect our girls and our boys against human papillomavirus. So there are, since 2006, there are vaccines that have been developed to deal, which are given to both girls and boys, so that let me explain what a vaccine is. A vaccine is, you are given something of the human papillomavirus, a very small amount, what is called attenuated, made different so that it can't infect you. So you are given that one, and when it reaches the body realizes this is a foreigner, and it mounts a fight against that vaccine. And the fight makes what is called fighter cells, which the body keeps as a memory. So if the person ever gets the human papillomavirus infection from somebody else, then the body is already set to fight it. So it is not only do you use your immunity, but you already have fighter cells to fight it. So one is able to kick off the human papillomavirus. So there are vaccines to be given. Ideally, girls are given between age 9 and age 26. Even if somebody is sexually active, let them get the vaccine, because it's not every strain of it's not every type of the human papillomavirus that has infected somebody. But it's better still to check whether one has HPV, and then if they are negative, then they are given the vaccine. So anybody from age 9 to 26, girls, they are freely given. Anybody below age 45 can still actually get the vaccine. If they check and they find they don't have human papillomavirus, then they can get the vaccine. Boys, we are not routinely giving boys in this country, but in other countries, boys age 11 to 13 are being given the Gardasil. There are different types of the vaccine covering different numbers of the HPVs, but the basic one, which is type 16 and type 18, that one is type 16 and 18 are the commonest strains, and they are the ones that cause about 70% of all the cervical cancers. Other cancers that the HPV, the human papillomavirus causes. And for these, it's not, unlike the cervix, there is no easy way of checking that you have it. In fact, you will know it is there, when it is already cancer. Unlike the cervix, where I said you can keep checking and know that it's changing towards cancer and deal with it early. So one of the cancers it causes is penile cancer, and that's cancer of the penis. Believe you me, you do not want to physically see penile cancer. It's a very nasty something. So if it needs to be seen early, when it is advanced, it's very, very nasty. So if there are any skin changes, any thickness of the skin, any ulcer that is refusing to heal on the penis, that somebody needs to see the doctor very quickly. Let's say any change in the body, somebody should actually see the doctor. Now, the anal cancer is pretty difficult to detect, but one of the ways is that you can start getting bleeding when passing stool. Now, blood is not allowed to come out of any other orifice except the vagina when a woman is having periods. So if somebody is bleeding from anywhere else, and if it is a postmenopausal woman bleeding from anywhere else, then they must not take it lightly. Blood is not just supposed to flow out of the system. So one can get some discharge in the anus, which is not stool, change in bowel habits when it's a bit more developed. But the first one is usually a bit of blood when passing stool. The other one is the vulva. Our vulva consists of two major lips, called the labia major, and two smaller lips. It also consists of where the mons is, where the hair grows. So all that is called the vulva. So if somebody sees any change, and this, let me tell you ladies, please take a mirror and look at yourself. Look at every organ that you own, including the vulva, including the vagina. Look at it at least once a month. And then if anything ever changes, you'll be able to see that something is now different. Is it the color change? Is it the swelling? Whatever it is. So please, let's not be shy. The vulva is just like the face. Look at it and make sure that nothing changes that should take you by surprise, because whatever cancer it is, if it is discovered early, if it is diagnosed early, most cancers it's possible to treat and cure. So if we are going to get cancer, let us get them early. So check those areas and make sure that your skin is not changing, that you're not having a funny itch that never goes, that there is not a pain that doesn't go away, and especially that there is no ulcer that doesn't start to heal within a few days. Now, the other cancer that is HPV related is the throat cancer, which you may be thinking you just have a sore throat or a ear throat or ear pain, something coughing all the time and swallowing that is a bit difficult in breathing. So anything changes in your throat, please see somebody who is called an ENT person, a ear and throat person, to just make sure that we are not talking about throat cancers. Very done, but after this one, I'm going to give a scary talk, a little bit of a scary talk. So in summary, HPV is the most commonly sexually transmitted infection globally. Like I said, by age 50, all people who have ever been sexually active, 80% of them do have or have had HPV, even if they kicked it out. Cervical cancer is the leading cause of cancer death in women in Kenya. Totally preventable, totally preventable. You don't ever have to die of cervical cancer. It's preventable by vaccine. It's preventable by screening. Now, the people ask me what's the difference between HPV and pap smear. And HPV checks the presence of the HPV infection, but it does not detect changes on the cervix. So we have what is called the self-collection kits, which we give people. They only check whether one has HPV. They do not check the pap smear. So if you are shy and you want to check yourself HPV, you can get a self-collection kit, and you said it, you pick your own stuff from your vagina, you said it. If you have HPV, then you must go for pap smear. Pap smear is the one that checks that the cervix is changing. So not HPV DNA. So it's pap smear and via and really the painting with acetic acid and leukocytin that can tell you that the cervix is changing. Now, the HPV is effective in protecting against HPV infection and hence reducing HPV-related cancers. In fact, in the Western world, because they've been doing pap smears for ages, and now they also introduced vaccine, you hardly ever see somebody with cervical cancer in those countries. The cervical cancer has been left in our country. To reemphasize again that HPV is spread from skin to skin, and that condoms offer very limited protection against the HPV, because condoms will only things like HIV, things like that, but you're not protected against HPV. But also, even with HPV vaccine, one still needs to get screened because there is no vaccine which is 100%. Even then, we don't have all the vaccine for all the 16 types. So this is our collective call to action: to stay informed, get vaccinated, and get screened as your health provider tells you. Now we'll go back a little bit. I want to give you a bit of a scare on cervical cancer. Cancer is very painful. All cancers are very, very painful. In fact, you don't want to watch a loved one go through cancer. Cervical cancer is got a pain beyond pain. If we look at that area where we put the speculum, just in front of the cervix is the organ called the urinary bladder, that hollow organ there. And just behind the cervix is the anal region where we store poo. So I already showed you the cervix that had cancer. Now cancer is like cauliflower. So it is meat. So when you do get cancer of the cervix, you have rotten meat on your cervix. And what happens is that meat keeps breaking off because it cannot be supplied with enough blood supply. It's growing too fast. So it keeps breaking off and coming through your vagina. So imagine yourself, imagine a loved one passing rotten meat through the vagina. Now it gets worse. The cervix is next to the bladder there. And when cancer occurs and spreads, it spreads locally and it spreads distally. So locally, the first thing the cancer of the cervix does is invade the bladder, the urinary bladder. And when it invades the bladder, it makes a hole in the bladder. So what happens is that urine passes from the bladder, instead of going out through the urethra, it passes from the bladder into the vagina. So now you have mixed rotten meat with urine coming out of your vagina. It is even worse. Right behind the cervix there is something called the rectum. Now the rectum carries stool. It carries poo that you're about to pass. And cervical cancer is also can spread towards the rectum and make a hole in the rectum and make the stool come from the rectum into the vagina. So you have a mixture of rotten meat, you have a mixture of stool and urine all together coming out of your vagina. And the thing about cervical cancer, unlike other cancers, it doesn't kill you quickly. The organs that it hits there, the bladder and the rectum, because they have it makes an outlet, it's not dangerous, it's not going to kill you. So you stay with this cancer, the pain of it, the smell of it. It is a very, very dehumanizing cancer. In fact, like I think you will post for you our TED Talk, women with cervical cancer pray to die, and they don't actually die quickly. And this is something that is totally, totally preventable. In fact, I don't know about now, but when I used to work in Kenyatta, there was a ward specifically dedicated to cervical cancer because it stinks. So you want to put those people together, you can't put them with anybody else because it stinks. The other cancers pain you and they kill you, but they don't lose you dignity like this. So please, I'm about to accept questions, but I hope I've scared you enough so that never, never will you or will your friend get cervical cancer.
Thank you so much for that incisive presentation. As we ready ourselves with our questions, please do so on the chat session or you can unmute yourself. Special recognition to the Advocates Benevolent Association, who without their partnership, this webinar would not have been possible. I can see my learned senior Byron now. We were looking for the men on the call, but clearly you are here now here with us. So as you prepare your questions, and I'll also read out the questions that you articulated within the registration form, please, Byron, you can kindly just speak up. We want to hear a male's voice in this call that is dominated by women.
Good afternoon, everyone. I hope my camera's on, or you can hear me. Yeah, that's a strange question that it's female dominated when I think cancer itself tends to be something that affects everyone. But of course, it's very informative and definitely something that we should all take on board. I think there's rates for cancer 1 in 3 in terms of affecting people. I see some questions coming in, which I guess you will deal with. But also one thing that I can personally speak about is that it's very important to learn as much as possible about cancer because the after effects and the going through the session, it can have a devastating effect on families. I've been there, been through it twice, and also the disputes that eventually arise out of such scenarios. So I think sessions like this are extremely important because they start to enlighten us on areas that we are going to face, but we are perhaps a little bit cautious about stepping in to learn about them. So Jogu, thank you very much for this session.
Thank you so much, Byron. You'll tell us a little bit about ABBA for all our colleagues who may not know. So we'll give that particular part towards the end of the session so that we can allow some Q&A. So, Dr. there are a few questions on the chat session. Why is it not possible to get the vaccine past 45 years? even after testing HPV negative? Why is it not possible to get the vaccine past 45, even after testing HPV negative?
Actually, it is possible to get the vaccine. It's just maybe not cost effective, because if somebody gets infection with HPV, it will take like 5 or so years for it to start manifesting problems. Now, before I leave that particular point, this is for people whose immunity is proper. Maybe I didn't mention that people who are who live with HIV, whether or not their viral load is undetectable. If somebody has HIV, then the chances of the cervical cancer, the cervix changing very quickly are very high. So it takes many years for the human papillomavirus to change the cervix in a normal woman. So that's why the cutoff is at 45 years. But it is okay to actually get it. Is that you will find many vaccination areas are giving up to age 45.
Well, can I hear someone speaking? The next question is, I know you had touched a little bit about this. Maybe the participant wasn't present, or maybe they want to have a clear distinction. Please tell us the best method for testing for cervical cancer. I know you had mentioned the 3. Maybe you could just have a small repeat for this particular participant. And in case there's anything that is outstanding in the 3 of them.
The best by far would be the pap smear, because that's the one that checks whether the cells are changing towards cancer or not. The HPV just checks whether you are at risk of getting cancer. So the best would be the pap smear. The VIR-VILI are also reasonable, but the best would be pap smear. If one can afford the pap smear, that's what to do. If you are normal immunity, that is, if you're not living with HIV, then we normally recommend between 1 year and every 3 years you do your pap smear, because if your immunity is good, then it's unlikely that the HPV will change you in the next 1 or 2 years. And it takes quite a while, and it's not one stage, it changes many stages, so we can detect it. So between 1 and every 3 years, somebody who is not immune compromised should do. If you are living with HIV, I'd recommend every 6 months have your cervix checked, because then with that things can change very, very fast indeed. So yes, that's the best would be the pap smear.
Thank you. So there was a question about how long should the pap smear test, but I think you've answered that. So allow me to now deal with the questions that were on the registration link. So there's a question about fibroids and contraceptives, and the participant asked this question: if someone has fibroids, is it necessary,
Yes.
number 1, to remove the uterus? And what are the potential consequences of delaying this decision? And can fibroids lead to cancer? Can they lead to cancer?
Can
I take the question again?
No, let me start with the cancer first. That as long as somebody is in the reproductive age, that means they're still getting their periods, the chances of fibroids becoming cancer is only 2%. 2%. If, however, you go beyond, you reach menopause, then the chances of fibroids changing into cancer jumps to 20 to 25%. So fibroids become a bit more dangerous after menopause. Now, the question was, should somebody always have their uterus removed? If the fibroids are small and one wants to preserve fertility, then we remove the fibroids only and leave the uterus in place. Now, as we go to remove fibroids only, we tell the person that they must sign that if by chance we have to remove the uterus, then we would need to remove it. Because sometimes when we are trying to remove the fibroids, there can be so much bleeding that it's not possible to control, and the woman's life is at risk. So we can remove fibroids only, or sometimes in very rare occasions, we have to remove the uterus. Now, when is it necessary to remove the uterus? Two situations. One, if somebody is getting into menopause with fibroids that are more than about 4 centimeters big. If they're that big and you're heading in towards menopause, please either have them removed or have the uterus removed. The other time that fibroids or uterus must be removed is the fibroids grow in the lower abdomen. And right there is where the ureter comes. The ureter is the pipe that takes urine from the kidney to the bladder. And sometimes the fibroids are sitting on that ureter so that the kidney makes urine, but is not able to take it to the bladder for urination. So if we find that the uterus is starting to harm the kidneys, then the uterus, either the uterus or the fibroids can come out. And the other one is if they are bleeding too much or, very heavy, so that they are putting your life in danger. So there are times we'll tell you remove fibroids. There are times we'll tell you leave them alone. There are times we will tell you remove the whole uterus. So it depends.
So this particular participant is asking, there is a stigma around pap smears. Number one, that it is painful and extremely uncomfortable. Perhaps kindly explain or shed more light on the actual procedure. I think this goes back to your statistics, why 9 women are dying daily.
Daily, yes. Now, the pap smear is not comfortable, but it's not painful. What we do is we just take a woman and put their legs wide apart and put something called a speculum into their vagina, and we are able to visualize, to see the cervix. And then we are able to, we take some cells from the cervix, which is not painful. In fact, the uncomfortable bit is when we are inserting the speculum. And that's where a lot of women, if you go and relax very nicely and you relax your buttocks and you relax your thighs, it is actually not painful. It's you feel an invasion, but it's not painful. So no, it is not painful. I know what people don't want is to be seen in their vaginas. And what I tell people when they say like that is that I'd rather I saw you now. But if you do get cervical cancer, you will be seen, upede usipede. And in fact, it will be bringing itself out. We will not even need to go looking for it. So please, please, women, just get your pap smears done. Go somewhere where you can relax very nicely and get your pap smears done. As it is, by the way, the statistics of pap smear in this country for anybody who has ever been done a pap smear is actually 3%, 3 out of 100. Now, when we talk about elite people like yourselves, then we are talking 16%, only 16%. So we have 84% of people who've never done a pap smear. Why? Because they don't want to be seen. But the commonest one I actually hear, which is very sad, is that they do not want to be told they have cancer. Now, to me, that is a very silly reasoning, because if I told you you have early cancer, I'll be able to deal with it. It will be cured. If you don't want to be told you have cancer and you actually are starting cancer, we'll get to you when you're stinking on us, when nobody wants to be near you. So please get pap smears done. It's not a big procedure. It's just open your legs a bit, and we put something called a speculum, and we put a very nice lubricant so it's not painful. But yeah, I suppose people feel shy and they don't want to be told that there is cancer. Yes.
What causes the people in the developing world more prone to cervical cancer? And you had just touched on it. People are shy. People don't want to know they have cancer. Have we missed anything else?
Yeah, they're actually not more prone. It's just that when they catch it, they keep it. So it's just they wait until it becomes cancer. The Western world kicked it out, actually, even before vaccine. They kicked it out with the pap smear only. But in those countries is where you are actually reminded on a yearly basis that come and do your pap smear. You know, those national health things. They call you, come and do your pap smear, which sometimes we try in the private clinics to do. It's time for your pap smear, it's time for your pap smear. But it should be that every woman who hears this should be able to be done pap smear. And women, a lot of the time, take children for, in the government hospitals, they take children for vaccines, they take children for well child clinic. Can they please divert and go to the well woman clinic and get done, even if it's via Vili, it will help. Let every woman be checked that their cervical cervix, any woman who has ever had sex stands a risk of getting cervical cancer. So let them get checked by whichever means, it doesn't matter. Pap smear may be a bit above their cost ability, but there is also still the VIA and Vili that can be done.
But the next question is, do IUDs contribute to getting cervical cancer?
No. No. IUD means intrauterine devices, contraceptive devices. No, they do not.
Sally asks, does one have to go for a pap smear when your uterus has been removed?
There are times we remove uteruses and leave the cervix. If you ever get your uterus removed, ask your doctor, was it total or was it subtotal? Because if the cervix is still there, then one still needs to do pap smears. And then much of the time when the cervix is left, is if we are removing the uterus in an emergency. For example, somebody is delivering a baby and they bleed too much and they are going to die from the bleeding. So we remove the uterus, then it's not possible to remove the whole cervix, the uterus with the cervix. The other time is if we are doing the removal of the uterus and, for example, somebody has had many other operations before and the uterus is holding on to the bladder and holding on to the rectum. So sometimes we do what is called subtotal. So always ask your doctor, was my hysterectomy total or not total? But we are also able, like if somebody comes here, I'm able to tell whether their cervix was left behind or not. So anybody with a cervix still in there needs a pap smear.
So Joyce's question is, there has been word going round about tampons and pads and diapers being made from material that is not cotton, neither is it's very deadly synthetic. And Joyce is asking, are these factors contributing as well to, elements like cervical cancer? Should want your comment on this. Is it possible to do that?
They will not contribute to cervical cancer. Cervical cancer, 99.7% of the time, is solely caused by HPV. So that's the one cause of cervical cancer. It's only that we can't say 100%, but literally the cause of cervical cancer is the presence of the infection of human papillomavirus. Now, having said that, there is something about tampons and about pads and about chemicals, and although they will not deal with cause cervical cancer, there is still something called skin cancer. So cancer happens in every organ of the body, skin, liver, nose, name it. So if you are into chemicals, if we were talking other cancers, we would have talked to these chemicals and things. But yes, chemicals are not things we want to use a lot. And the other thing about, let me warn people about tampons, is that a tampon must not be worn for more than about 4 hours. And the reason being that when it is in there, you are not allowing oxygen to go into your vagina. Your vagina needs oxygen. It must be allowed to have oxygen. If you block oxygen from your vagina for any length of time, and especially since you are having a tampon, it has got some dead blood in there, you can get a very nasty infection that can even kill you by overstaying with a tampon. So be careful about tampons. You wear it, you remove it very frequently, no more than 4 hours, and definitely don't ever sleep with it. Now let's talk about panty liners. And panty liners, please, ladies, stop wearing panty liners. Just wear cotton panties, soil your panties, and then throw them away. What panty liners do also is they block oxygen going into your vagina. And instead of the good bacteria that we have called lactobacilli that love oxygen, then you grow other bacteria that are what we call gram-negative. They don't like oxygen, and those are not healthy bacteria. So please avoid. But yes, chemicals can cause skin cancer, but they are not associated with cervical cancer.
A question on treatment and cost. Are there free or subsidized options for cervical cancer testing? I know we had the October Cancer Month. Maybe you can also highlight any other that we are not aware of, if they have extended, I think, offers even from where you are at.
That one I will not be able to answer. I don't think there are, maybe in government hospitals, which I'm not very familiar with, but in private hospitals, even if they are there, they are subsidized. Even if they are subsidized, they are not totally free. So I don't think so, but I'm not sure. That's a question I can't answer.
That's fine. So we have always had this question, especially when we are dealing with women conditions. The element of nutritional play when it comes to sort of preventative measures. Is that the same case with cervical cancer, or because it's caused by HPV, nutrition per se does not play a part?
No, nutrition plays a big part. Nutrition, when somebody gets HPV, whether they are below 30 or above 30, actually, it's more common that the below 30 will kick it out. But the whole spectrum of age of woman, then about 80% of all HPVs is kicked out by the system. And the reason why the system kicks it out is that it has got good immunity. And why we have good immunity is because we have good nutrition and we are physically exercising. So nutrition, in every cancer, it counts. Even in other cancers where, even in the spread of cancer, for example, there are at times, there is times when the body can detect there is a cancer cell there, and the immunity system picks it and kills it. In fact, takes it with what is called the lymph and kills it in the liver. So we need a very, very high immunity to deal with cancers, all of cancers, including cervical cancer.
Okay, questions are way too many. I don't think we're going to manage to exhaust them. Two last questions I'll take from the registration form. How is cervical cancer different from ovarian cancer? And has the link between ovarian cancer and menopause been researched? Is there a correlation? Is cervical cancer different from ovarian? And is there a link between ovarian cancer and menopause?
Cervical cancer is on the cervix. The cervix is the mouth of the uterus that opens to allow a baby out and closes a baby inside when they are pregnant. So that's the cervix. That's cervical cancer. The ovary is the manufacturer of eggs that make babies. So it's a totally different organ. Now, cervical cancer is very easy to detect because we can screen for it. And like I said, we catch it before it becomes cancer. Ovarian cancer, on the other hand, it gets more common with age. In fact, other than cervical cancer, which is sexually transmitted, every other cancer, there is an age an age group that starts to get cancer. Anybody above 40 now, you have entered the cancer age, and you need to be screening for cancer. So ovarian cancer is a totally different cancer. The bad thing about ovarian cancer is that the ovary is a very small organ that is found inside the abdomen. So by the time an ovary grows, because cancer is something that grows and makes the organ bigger, by the time you start to notice that an ovary is growing, it has multiplied itself almost by 10. So how do we check for ovarian cancer? And yes, it gets more frequent with age. Everybody who is above 35 needs to do what is called a pelvic ultrasound on a yearly basis. That's the only way to know that my ovaries were this size this year, and next year they are this size. Now, for women who have reached menopause, as the ovaries stop producing eggs, they start to get smaller. So there comes a time, in fact, towards age 65, 70 there, when you are done the ultrasound and you're told your ovaries cannot be seen, they cannot be visualized, which is a very good statement. Now you need to keep doing that ultrasound. You are told your ovaries are this size, they are shrinking this way. If they had disappeared and they reappear again, or if they hadn't disappeared but they start getting bigger, especially when you're into menopause or even before menopause, then you have to really screen. You have to check for what is going on with that ovary. There is a size that it should be. The other thing that ovarian cancer does is it's the producer of hormones, so it can make somebody bleed. So any woman who has reached menopause, if you ever see blood, it could be that is ovarian cancer. It could be that is cancer of the inside of the uterus called endometrial cancer, or it could be that is cervical cancer. So please, any blood, when somebody finishes period, gets into menopause, and they have stayed 2 years without seeing a period, any other blood that comes through the vagina, you have to run to the doctor to find out what it is. There should be no blood coming out after menopause.
Thank you so much, Dr. The questions are way too many. Time does not allow us to completely exhaust, but I think you can share. I think the first slide is where you're located, I think within Nairobi Hospital. You can share that slide such that anybody else who needs to get in touch with you, they can find you there. So ladies and gentlemen, allow us to stop the Q&A for that particular moment. Please, you can find Daktari at Doctor's Plaza, second floor, room 211, and therein lies her contacts as well, her phone number and email and all that. So, ladies and gentlemen, allow us to just have one final take by Abba so that they can tell us what they're all about as we wrap the conversation up.
I'll be fairly brief. So the Advocates Benevolent Association is the welfare arm of the Law Society. It hasn't had as much prominence as it should. And one of our main key elements for our term is to try and raise the visibility so that every advocate in the country knows that ABA is available for them. I'll go straight into the programs we currently have. We have a last expense cover. So in the unfortunate event that you pass away, your family will get a payout of 80,000 Kenya shillings. In the event that you go into hospital, the Advocates Benevolent Association will pay 100,000 shillings towards your hospital bill. I must add that this is a one-off. It's not an ongoing payment. It's a one-off currently. We then have an educational assistance program. So in the unlikely event or the unfortunate event that you pass away, the Advocates Benevolent Association will educate all your children, whether within the formal marriage or not, from nursery all the way to university and or the Kenya School of Law. So it's extremely important that you let colleagues, your friends, family know that these benefits are available as an advocate, as a paid-up member. That's one particular point that I need to re-emphasize. Every year when we pay for our PC, the payment to ABA is included in that payment. As it is, as long as you're paid up, you're allowed to benefit from all these programs. When you become inactive, unfortunately, at the moment, as these are our current rules, you cannot actually benefit. There's also the option for lifetime membership. I get a lot of questions on this. Lifetime membership is 150,000 as a one-off, and then you're entitled to the benefits for the rest of your life, even if you stop practicing. We also have a partnership with the Counselors Psychologists Association of Kenya. We pay for the first counseling session and then subsidize the subsequent sessions. They start at 1,500 after the first session. We also have some partnerships with organizations in Nairobi in particular, though we are now in the process of partnering with organizations outside. But we have a partnership with Hill Park Hotel, which is next to Lower Hill Duplex. They have discounts on hotel rooms. They also have discounts on food. We are in the process of signing with Ole Ken in Nakuru, America, and Waterbuck. We're also in the process of signing with Acacia Hotel in Kisumu, Shama Hotel in Kisumu, Golf Hotel in Kakamega, and Western Star in Kakamega as well. This Friday, we will be signing with Bowes Optical, an MOU to give members free treatment and for eyes, for checkups, and also discounts. We'll also be signing with Kenya Women's Finance Trust, last expense cover, which starts at 700 shillings for a payout of 100,000. It also has a very useful family cover, which starts at 3,000 and covers 10 people. So once we sign, we hope members will then take notice of these products and start signing up. I don't want to go any further. I'd just like to thank Dr. Jane and, of course, Muthoni and Njogu for this session. I hope everyone has learned a lot, and thank you for giving me a few minutes to just inform members on the Advocates Benevolent Association and the few programs we have in place right now. Thank you, Muthoni.
Thank you as well, Byron. Allow us to now bring this to a close. Thank you so much, Dr. Jane. But I want to read one remark from one of the participants. She says, "Thank you, Dr. Wakahe. You continue to inspire all of us as women. We are riding on your shoulders. I'm a researcher by profession and a trained palliative caregiver, and I value such sessions." And she ended her statement with saying, "I love you." So I think you're really making a difference in terms of cervical cancer, the knowledge and all that. So thank you so much, ladies and gentlemen. We'll definitely have more sessions with this. And of course, we hope to partner with ABBA as well moving forward. And I think you have heard that, Terry, there's so many areas of partnership with ABBA as well, because they take care of our welfare part about being a lawyer. So ladies and gentlemen, we bring this to a close. On to the next webinar. Do have yourself.
May I say something? May I say something before you close?
All right.
Sorry, I've sent a TED talk that I did so that people can get nicely scared. It's called the Nearly Preventable Cancer.
Yeah.
Please look at it and tell your friends to look at it. And second thing is that if you need the questions that were not answered, you can send them to me. I'll find a way of answering them.
All right. Thank you so much.
And thank you very much. Thank you. I've enjoyed.
Thank you as well. So we'll definitely be sending the questions over to you. Please, colleagues, let's get into that TED Talk. Nearly, Dr.
The Nearly Preventable Cancer.
Ladies and gentlemen, have yourselves a good afternoon. Bye-bye.